complement is like a hidden force in the immune system, working quietly in the background to destroy pathogens, trigger inflammation, and enhance phagocytosis. But what happens when pieces of a complement system go missing? That's when you see serious immunodeficiency, autoimmunity, or even hemolysis. These are must know high yield facts for the USMLE, and they show up in classic clinical vignettes. Let's start with C1 to C4 deficiencies. These proteins belong to the classical pathway of a complement activation. When any of them are deficient, especially C1, C2 or C4, you will see an increased risk of infections, particularly with encapsulated bacteria like Streptococcus pneumoniae. But here is an even more testable point. They are strongly associated with the systemic lupus erythematosus. Why? Because these proteins help clear immune complexes. When they are missing, immune complexes build up and trigger autoimmunity. So if you see a young woman with signs of lupus and a complement deficiency, and this is your clue. Now move downstream to C5 to C9. These components from the membrane attack complex, which punches hole in the bacterial membranes. When someone has a deficiency in any of these, especially C6, C7, C8 or C9, they lose that MAC function and become highly susceptible to Neisseria infections, particularly Neisseria meningitis and Neisseria gonorrhea. If a young, otherwise healthy person develops recurrent Neisseria bacteremia, always consider a terminal complement deficiency. Next, let's revisit C1 esterase inhibitor deficiency, which causes hereditary angioedema. This is not just a swelling issue, it can be life-threatening if the airway is involved. These patients have low C4 levels during attacks because unregulated bradykinin leads to increased vascular permeability. Importantly, AC inhibitors are contraindicated in these patients because they can worsen bradykinin buildup and trigger angioedema. Finally, we have paroxysmal nocturnal hemoglobinuria. This condition is caused by deficiency in surface proteins that regulate complement, namely CD55 and CD59. Without these inhibitors, red blood cells become vulnerable to destruction by complement. So the result is intravascular hemolysis, especially during the sleep due to mild acidosis that activates a complement. Patients often present with dark urine in the morning, anemia and sometimes venous thrombosis. So what's a confirmatory test? Flow cytometry for CD55 or CD59 on RBCs. A quick recap. Here is your high yield roundup. C1 to C4 deficiency increases the risk of SLE and encapsulated bacterial infections. C5 to C9 deficiency leads to Neisseria susceptibility. C1 esterase inhibitor deficiency causes hereditary angioedema. And DAF or CD55 deficiency results in paroxysmal nocturnal hemoglobinuria. Every one of these has shown up on the USMLE, often in deceptively simple clinical cases. The more you understand the complement, the more immunology makes sense. Keep connecting the dots. You are not memorizing, you are mastering. Stay sharp, stay confident, you have got this. And I'm Dr. Ram here from MedMadness, and see you next podcast. Thank you so much.